Distal humerus fractures. Published by WordPress.com. Page 1, distal humerus hash. Page 2, capitulum fractures. Page 3, other hash. Page 4, pediatric hash SCH. Page 5, cubitus varus valgus. Page 6, separation of physes. Page 7, pulled elbow. Incidence. Bimodal age distribution. Young males, 2nd decade. Older females, 9th decade. Anatomy. Distal humerus, composed of medial and lateral columns. Supracondylar ridge, epicondyle, condyle, articular part. Trochlea articulates with the sigmoid notch, flexion, extension. Capitellum articulates with the radial head, supination, pronation. Types of fractures. Supracondylar fractures, single column fractures, bicolumnar fractures, coronal shear fractures. Classification. 1. AU classification. Extra-articular. 13A1, avulsion. 13A2, simple. 13A3, multifragmentary. Partial articular. 13B1, lateral sagittal. 13B2, medial sagittal. 13B3, frontal. Complete articular. 13C1, simple. 13C2, metaphyseal comminution. 13C3, multifragmentary. 2. Intercondylar fractures, Riseborough and Radin classification. Type 1, non-displaced. Type 2, slight displacement without rotation. Type 3, displaced with rotation. Type 4, severe comminution. And 3, condylar fractures, Milch classification. Type 1, lateral trochlear ridge is part of the condylar fragment. Type 2, lateral trochlear ridge remains intact. Imaging. X-ray, fat pad sign, lateral view, suggests non-displaced fractures with joint effusion, hemarthrosis. CT, for detailed fracture assessment. Management. Goals. Anatomical reduction, early range of motion, ROM. 1. Conservative. Indications. Non-displaced fractures, highly comminuted fractures in elderly unfit for surgery. Methods. Above elbow cast, neutral, supination, or pronation depending on fracture type. Bag of bones, technique or collar and cuff. Traction with O'Cranon pin. 2. Operative. Closed reduction and percutaneous pinning, CRPP. Indications. Minimally displaced unicondylar fractures, pediatric fractures. Methods. K-wires or screws. Open reduction and internal fixation, ORIF. Indications. Displaced fractures. Methods. Supracondylar, bicolumnar fractures. Posterior approach with double plating, medial, lateral posterior. Unicondylar fractures. Specific incision, screws, or anti-glide plate. Total elbow arthroplasty. Indication. Unreconstructible injury in elderly with good pre-injury function. Complications. Median nerve neuropathy with fractures. Ulnar nerve injury with surgery. Cubitus varus, valgus, tardy ulnar nerve palsy. Osteoarthritis, OA. Joint stiffness. Myositis ossificans. Volkmann ischemic contracture.